I get many questions about the different types of liposuction, how they are used, are the results different, is there less bruising or swelling with one type over another? The simple answer is no. We have three basic types of liposuction available: standard suction-assisted liposuction, laser-assisted liposuction, and ultrasonic-assisted liposuction. Each works, but it is up to the individual surgeon to determine the area to be contoured by liposuction and determine how it is best treated. In the final analysis, there is no substitute for skin elasticity. Think of your skin like a balloon. When the air is removed from the balloon, the skin of the balloon must shrink down to accommodate the new volume. If the skin of the balloon does not shrink down, the final result will inevitably be a loose balloon. As a plastic surgeon, we have many different methods available to contour the body. For those with loose skin or multiple stretch marks, liposuction may not be the right answer for you, and you may be better served by a procedure such as an abdominoplasty or a thigh lift. All modern liposuction is performed using the tumescent technique, and there's really nothing new about this. This simply means a wetting solution is infiltrated into the fat layer prior to liposuction. This does two things for the plastic surgeon. One, it slows down bleeding, and two, it magnifies the space, making for a more meticulous contouring of the fat layer. All brand name liposuction techniques require the use of tumescent liposuction. What is smart lipo? Smart lipo is basically laser lipolysis using a neodymium YAG laser. I find this type of liposuction very useful for areas of tough fibrotic fat. Smart lipo just melts fat, and regular liposuction must be used to remove the fat that was melted. Smart lipo in and of itself will not shrink skin. However, by using a temperature probe on the laser and a thermal camera, we're able to heat the deeper subdermal tissues to 55 degrees Celsius or 130 degrees Fahrenheit and heat the skin to 40 to 45 degrees Celsius. The thermal camera allows this dermal heating while not burning or injuring the skin. This causes a deeper tightening of the dermal collagen layer, resulting in a dermal tightening. Each patient must be evaluated to see if they are a candidate for this more advanced treatment. It is important to know the difference between using a laser to melt fat versus tighten skin. Liposuction is designed to remove fat. When the skin is tight, removing fat leads to improved proportions and a nice smooth result. The key feature of liposuction is the ability to remove fat and leave the skin uninjured. Incisions are required, but these are small and can be placed out of the way. Elastic skin will shrink to the smaller dimensions after the fat is removed, but the amount of shrinkage varies widely. When there is an excess of skin, tightening is required. This may include an abdominoplasty, thigh lift, or lower body lift. Well, who is a good candidate for liposuction? In my opinion, there are two candidates for liposuction: good and not good. A good candidate will get a good result, and a poor candidate will get a poor result. The most important thing for a patient to know is that liposuction plus loose skin usually equals bad result. Skin that is already folding in most cases will fold more after the fat supporting it is removed. Think back to my analogy of a balloon. As the skin collapses, it will become irregular in contour. At the time of your consultation, you'll be examined, and at that time, we'll be able to determine if you're a good candidate for liposuction. If you're not a good candidate for liposuction, it is possible that you're a good candidate for some other form of body contouring. This is why it is so important to see a qualified, board-certified plastic surgeon who understands your condition and is able to provide the full spectrum of body contouring techniques and not just liposuction. Well, I hope this has answered some of your basic questions about liposuction, and I look forward to meeting you at your consultation. Thanks.